Hi, welcome to Facebook Live. I'm Dr. Annette Mercatante, and welcome back to our live COVID question and answer session. If you have questions, please submit them to the comment box, and we'll also try and review whatever questions have come into our COVID-19 email site throughout the week. So we'll start out by going over our epidemiology or our data. Cases continue to come in at a pretty brisk pace at about 70 average cases per day. Our testing positivity remains well over 10%, closer to 13%, and we have had 6 more COVID deaths. So you can see the totals there, but I think the big news is the next slide, which is the same news that we had last week, which is we're still plateaued. We keep looking for that indication for a drop. We'll get a day where it seems like it's going that direction, and then it seems to come back up. So, as I have mentioned before, this may suggest that this is where we're going to stay for a while. We would expect a decrease at some point. And what happens after the drop, whether we have a spike or not, really does remain seen. Some areas are seeing spikes and some are not. So we're just going to have to follow this data along. But I think the big news here is this is a pretty sustained high transmission level. And we do want people to continue to do the things we know can prevent further spread. Next slide. So this is our vaccine data, and I think there's some really encouraging news here. So the large gray bar shows the additional booster doses. So many of you are coming in to get your boosters. I think that's wise. I think more data we see, the more we recommend that boosters are going to be an added benefit to those who are fully vaccinated. Vaccine immunity does seem to wane over time, as does natural immunity. So if you're banking on the fact that you had an infection back in January, you may want to think twice again about getting vaccinated. Now, the other piece of good news, it's not quite as apparent, but on the blue bar, the blue section of that bar, you can see we've done 444 first doses, which is a pretty good jump from the previous few weeks. So that would suggest again that people are thinking through this, looking at the data, which is overwhelmingly favorable with these vaccines. Millions of doses with very few, extremely rare complications, as opposed to the fact that this disease continues to run rampant through our community and throughout the world. So the other things is, what are you planning on doing in the next few months? You're going to travel, you're going to visit friends and family. Vaccines are absolutely an added benefit to that. So next slide. And this is, we get a lot of questions about, hey, what's the rate of vaccinated cases versus unvaccinated cases? So we're going to kind of keep this. Are we posting this yet? Probably not yet. Oh, yes. I think we are planning on posting it. It's probably not up yet, but this is a graph that we've developed that compares, and this is just our county. There's actual data as well on the state website, as well as the CDC site, the national data that confirms this as well. But you can see with the red line, that is the unvaccinated number of cases versus the blue line, which are the cases that are occurring in vaccinated individuals. And again, a pretty significant differentiation. Next slide. So I'm going to add this because I wanted to clarify this. With any luck, we will continue to see our vaccination rates rise. And this is something that I think is very important for people to hear about. And we'll try and repeat this so that when we reach a state of high vaccination levels in our community, you won't be surprised when people who are getting infected are in fact vaccinated. And what these two scenarios show is the same number of people. On the one side, people who where 50% of the population is vaccinated, which is similar to what we have, and on the right side, you'll see where 90% of the individuals are vaccinated. And in this scenario, we're assuming the same thing, that the vaccine's 80% effective, that we have a 2.5% infectivity rate, and we have 2,000 total people. And what you can see, that given the number of different vaccine how much vaccine is in the community. In a situation where 50-50, you will see more people who are ill in the unvaccinated group. So that 2.5% equals 25 people. But in the vaccinated group, which would also you'd expect 25 people, the vaccine has prevented 80% of the infections, and therefore you only see 5 individuals. Now, if you take that scenario over to the right-hand side, same situation, and you only have 10% of the population that's unvaccinated, when the disease uh, impacts 2.5% of that group, you'll see 5 cases. But if the disease likewise affects 2.5% of the vaccinated population, which is 90% of the population, is a lot more people, you will then see 9 people with cases, even though the vaccine has still prevented 36 additional cases. So you might want to study this. I don't know if we've put this up yet, but I did want to share with you the scenario so that you're a little familiar and comfortable with this idea. It's math, it's statistics, it's epidemiology. It's a little hard to just kind of sink in, but this is the reality of vaccine preventable diseases, that as we get more and more vaccine into people's arms and the immunity gets better, you will in fact see more disease in the vaccinated population. And that's not because the vaccine's not working. Vaccine is working just fine. So next slide. Oh, we got one more. Okay, so if you have 100%, this is another example. If you have 100% of the population vaccinated, which hardly ever occurs, I might add, but then you will see that everybody who gets the infection will be vaccinated, right? Because vaccinations, number one, are never 100% effective. I think an 80% effectiveness rate is really quite good. And it looks like this may be where the COVID vaccines are going to land over time on the average. And that the infection rate may change, but if we get infections in a community that's fully vaccinated, they will all be in vaccinated individuals. And again, that's not because the vaccine's not working. So I'll just leave these. We might come back. I'd like to come back to these on a regular basis to kind of go over it. Maybe we'll put some of this on our website. I just want people to become familiar with this so that it doesn't confuse them when somebody they know that's vaccinated does in fact come down with COVID. The other thing we know about COVID vaccines is it prevents more serious illness. So again, even though you can get COVID, you can get COVID, get seriously ill, the chances of you landing in a hospital, I believe now the ratio is like 1 to 10. I think it's something like that, right? Am I misplacing it? The numbers keep adjusting, but there is a clear difference between those who are vaccinated landing in the hospital and dying versus those who are unvaccinated, much higher in the unvaccinated group. So next slide. Our dashboard, which we'll continue to try and update and make more user friendly. We have some website changes coming up, so that may make things look differently, but we'll just keep trying to adjust these this data for your benefit so that it gives you the information that you find most helpful. Okay, now I'm supposed to go to my talking
So,
points.
yeah. So the big news is the pediatric COVID-19 vaccine I'd like you to talk
Which the
about.
ACIP met this week and approved it, and the CDC has released its guidelines. So vaccine is actually already in the hands of many of our pediatricians, and we have some. So we'll be setting up those standing orders and getting ready to vaccinate. We will be vaccinating by appointment. Your pediatricians obviously are going to vaccinate by appointment. And obviously the recommendation, if you haven't heard, is for 5 years of age or older. It is for the Pfizer vaccine only, and up to 12. It's a 2-dose series, 3 weeks apart. And it is not the same dose as the adults. It's in a different vial. It looks different. It's a third of the dose of adult vaccines, which are the 12 and older. And we want everybody to make sure that they seek out this vaccine as soon as possible. So we also want people to know to call 987-5300 for these appointments, and we'll be watching to make sure everyone gets access to this vaccine. We do not currently plan on, I'm going into your next question, Jen, but it's connected. So we do not currently plan to hold any mass school vaccine clinics. But if the need comes up, I've said this before, if it appears that seems to be what the need is, we'll kind of reconsider those thoughts. But we're thinking that between the pediatricians and access here, that those who want the vaccine can easily acquire it. The other piece of information is our Veterans Day, November 11th. Is that really Veterans Day? Wow.
Yes.
It doesn't matter. I'm not going to be here. So we're not going to have a Facebook Live session next week. I will be back the following week on Thursday, normal time, and we'll just take off from there. If you do have questions, though, that you feel can't wait until the following week, please send them through the COVID-19 email, which seems
One
to be
thing,
working out pretty well. Okay.
yep. One thing I just wanted to note too, Doc, that people can self-schedule their vaccine for COVID vaccine appointment on our website under the
Oh,
COVID
thank you.
vaccine section. So we have two different links, one for older and then now a new pediatric section for parents and caregivers to make
Okay.
those appointments for the age 5 and 11. But we do encourage, like you said, people to seek it out from their pediatrician or healthcare provider office or pharmacies as well.
Okay.
Okay, and you already answered the question that came through last night. Will there be a vaccine clinic for 5 to 11? So we'll move on to the live questions. All right, this is from Melissa. She asked, can I get my child, 5 through 11 years old, a flu shot at the same time as their COVID shot?
Melissa, you're my hero. Absolutely. You do not have to space these vaccines out. You can do them at the same time, and I would encourage you to do them at the same time. That they don't giving them at the same time doesn't interfere with each other's effectiveness. It does not increase the side effects. Which is true for almost all vaccines. The only thing that'll change is if you do have a bad day. These COVID vaccines carry with it a short interval where you can get fevers and muscle aches. You won't necessarily know whether it's from the COVID vaccine or the flu shot. But since most of these side effects, the vast majority of them are mild, and they wouldn't be an indication to not get your second dose, that would be perfectly fine. And
All
I
right,
just say that I think if you get them all at the same time, you're a lot more likely to get them. As if you start spacing out vaccines over a course of several weeks, it's just hard, right, to come in multiple times and do that. And your kids got to worry about getting another shot. That anticipation of getting a shot is often worse than the shot itself. So I always think just kind of getting it done all at one time is to the benefit of everyone. So I'd encourage that.
All right, the next question is from Lori. She asks, if a person has both vaccines and still gets COVID, how long after an infusion treatment should one get a booster shot?
So after you've had a monoclonal infusion, you need to wait 90 days. Okay. So you'd want to wait that 90 days for your booster shot. And that's just kind of I think quite honestly, it's kind of an arbitrary amount of time that they've looked at how long the monoclonals last in your system. Am I right? It's 90 days, right? Okay. Not 60 days. So 90 days is just kind of the term, what we used before. We would assume that treatment is fully out of your system and it won't interfere with the vaccine itself, the effectiveness of the vaccine. So you'd be stuck holding off a little bit longer.
All right, and Mary said that the question had already been answered, but just in case anybody else was wondering and didn't hear, would we ever administer the COVID vaccine shots to kids 5 to 11 without parental consent?
No, no, of course not.
Mary also asked, is there a way to zoom in on the slides, the data slides, when we're showing those? I don't
Oh, I
know.
don't know. So when we post them on our website, they can zoom in then? Okay. So that would be your question. I don't know how to do it here, but we can talk to our IT people if that seems to be something you guys want to do next time we do Facebook Live.
All right, this is from Barbie. She asked, if it were you, would you have Thanksgiving dinner unmasked indoors with family members if all of us were vaccinated, even though some of us are careful and some never wear masks? It truly is easy to play it safe so that we alienate our families.
Barbie, what a great question. So it was me. I have a really tiny family. Okay. I have a family of like 3 people. So it would be really easy for me to say that because it'd be a fair, it'd be fairly comfortable knowing who's vaccinated and what the risks are. Um, So number one, you have to know what the risk are of the people at the table. Do you have somebody at the table who's immunocompromised or struggling with a cancer treatment or doing something that if they were to get infected could be a big problem for them, in which case you might want to have some extra layers of protection, masking when you're not eating, trying to make the room a little bit bigger, opening your windows up for ventilation. And I can tell you one more strategy that is starting to become more and more clear that may be beneficial, especially in a high risk situation where you really want to be together, but you're not quite sure how safe it is. Have people test before they show up. Okay, there's testing available. You can buy over the counter tests now. They're still a little hard to come by, but I think that's going to get better real soon. It's not perfect, but if you have family members do their COVID test within 5 days of showing up, it's another layer of protection. And of course, you don't want anybody coming if they have had a real known high risk exposure or if they're starting to feel sick, especially without getting tested first. And that would be another layer you'd want if there was exposures. Um, and they want to come anyways, and it's really important that they're there. Have test them. I'm starting to think that that's going to be the approach we're going to be taking. I don't want to say in infinity, but clearly this virus is not going anywhere. We can't just pretend it's going to go away. We can't pretend that it's meaningless because the severity of this infection continues to be significantly higher even than in the flu season. So we need to think of ways of wrapping our head around reducing risk. And I think besides vaccinating, which is very important, and by the way, that now we have the vaccination with the booster and distancing and ventilation. Don't forget hand washing. Don't forget hand washing. Have hand sanitizers, and then another spike of that wheel can be testing. So I didn't really answer your question. Am I gonna do things with people on Thanksgiving? Yeah, probably. But if I were ill or exposed, I'd probably think twice about it. And in those situations, probably do a self test before I showed up.
All right. The next question is from Donna. She said, if this has already been asked and answered, I apologize, but is there a difference between the booster and third dose?
Well, we talk about it every week, but it's a great question. And there is a difference. There's a big difference. So the terminology third dose refers to the need to get 3 shots instead of 2 as your primary series to induce your initial immunity. So we know that for certain people, immunocompromised people, people who have certain conditions, medical conditions that prevent their body from mounting a good immune response from the standard 2-dose vaccines, in which case a third dose of one of your mRNA vaccines is recommended. And that is same interval as the first 2, right? So 1, 2, and 3, all 3 weeks apart. Now, that is not true for the J&J. The J&J has not advised a second primary dose because remember, J&J is a single dose for your primary series. So a booster dose is a dose you give 6 months after you finished your primary dose. And that's because we know if over time, and 6 months is kind of, again, has been used just because that's where the studies show the reduction in immunity for many people, not all. Okay. But after 6 months, you get that booster dose. And that can be after 6 months of your primary series, which could be 2 doses of Moderna or 3 doses of the Moderna Pfizer. I should say Moderna Pfizer, or 1 dose of J&J. And you can use any formulation of vaccine for your booster dose. It's another little added little piece. So if you had a little trouble with one of them, so you've got an mRNA vaccine and you had a lot of trouble with it, you could try the J&J instead. I hope that helps. It's a common area of confusion, and hopefully we have some. Do we have those single page summaries on our website as well yet? Remember we had those really good ones about what's a
Oh, the
booster and what time frame.
infographic?
Yeah, the
Yeah.
infographic. Okay.
Yes, we do.
So please
Mhm.
take a look at that because I think sometimes a picture is worth 1,000 words, especially my words.
Okay. The next question is from Michelle. She said, "What is the best way to air out or disinfect an area in your home that a COVID positive family member has isolated in? Can other family members enter the area after a 10-day isolation period?"
Yeah, so that's a good question. I think it's just standard disinfectant cleaners. Anything that has a virucidal component, your Lysol cleaners, your bleach cleaners, don't use it according to the manufacturing direction. You don't have to pour straight bleach on it. We just want normal cleaning products, okay? The virus is spread through our respiratory system, so it's generally in the rooms where people have been breathing. So if you've been isolating because you've been COVID positive and you've been isolating in the basement, that's the area that you would want to primarily focus on this cleaning. You want to clean up any frequently touched surfaces or things where your breath would, think about respiratory particles and they eventually fall out of the air over time. They take a different amount of time depending on the size of those moisture particles, but they'll just generally fall down and land on a surface. So that would be the cleaning. Ventilation, I don't know. There is, I think, I think there's a standard amount of circulation per hour. I'll have to get back to you on that. But I mean, windows open, fans on. I think that's the easiest way you can think about it. You want fresh air. You want that air to be recirculating at a certain amount per hour. I think they measure it per hour. I have to thank you for that. I'll have to check on that.
You can
So,
put that in your talking points for the next time.
yeah, we'll do that. And so if you want to actually now, I don't know how many of you can actually measure that. I mean, there are consultants, environmental health consultants that can check how much air circulation in your house. But I think most of us just have to resign ourselves to the fact that we're going to open our doors and windows. And if you have a lot of people, throw a fan in there as well. So can you enter a home where safely where someone's isolated? Well, if it's been cleaned and it's gone through that circulation, air circulation piece, and the air has been cleaned, yeah, I would say that that is true. It doesn't appear that these viruses linger for long periods of time. The question is, you don't know in that 10-day period if the person was still infectious on day 7 or 8. I mean, remember, we use 10 days because hardly anybody's still infectious after 10 days, but they could still be infectious after day 7, right? So there's a little bit there that you got to pay attention to. And I guess I would suggest that you stay out of the sick room, stay out of the rooms that have been there, where the person has primarily stayed, and you should be okay. You should be okay.
All right, the next question is from Linda. She asks, "Is there a booster for Moderna? And how long after the second shot before I need a booster?"
So there is a booster for Moderna. So all three of the vaccines can be used as boosters for 18 and older. The difference for Moderna is they recommend a half a dose or half of a quantity as opposed to the primary dose. And the other two, you just use the same amount that you did for the primary. So that's the key with Moderna. You just got to remember not to use the same amount. Um, all of them are 6 months after your primary series. All of them.
All right, the next question is from Michael. He asks, "Does anybody do home shots for homebound seniors?"
Well, we had a system in place with the VNA in conjunction with Council of Aging, and we did as many homebound vaccines as we could for the primary series, or were actually that were needing it because I think the request kind of stopped. But we don't have that necessarily in place for the boosters. So for the booster shots, we're still looking maybe for some drive-up options. I don't know that we have an absolute answer. Jen, did anything come of the conversation yet with VNA?
Well, when we talked, no, not with VNA.
Okay.
Um, there was some talk about possibly Marysville fire being able to do some
Yeah.
if they were in
We didn't
close
really get anywhere
vicinity.
with that though.
Yeah, so
So
we're still
in
looking.
progress. In
Yep.
progress. For the boosters in progress. For the primary series, we got it done. But I think we still have to look at options for boosters.
All right, Cindy asks, "Can you catch COVID using the same toilet as an infected person?"
I don't believe there has been any documented transmission of disease through excrements, right? Through fecal or urine contagiousness. Now, is it possible? I think it is possible because you can detect virus in both those specimens, but we don't believe the virus is transmitted in that way. The virus has to land in your respiratory system to invade your cells. It won't invade your cells through ingestion or through your skin. Okay. So fecal oral is what we talk about contagion from urine and feces is generally a contagious from getting something on your hands and then putting it in your mouth inadvertently. I know it sounds gross, but that's kind of what happens, which is why washing your hands super well after you've toileted is really important. So, is it theoretically a possibility? Yes. It has just not been indicated in any of the articles and the research that I've seen. And I would just say good hand washing would be your ticket there. You wouldn't have to worry about it.
Well, you think too about some people who live in the same household and maybe one person in the family has COVID and the other doesn't, and they only have one bathroom, right?
hmm
So it
So they
just,
just have to clean, right? They would
yep.
want to clean the surfaces. But again, the belief is, and I think that the overwhelming data would support the fact that this virus infects us as it's floating through the air. So once it's landed on something, it's not likely to be re-aerosolized. Um, I suppose, but I suppose you could contaminate your hand and then rub your eyes or put your fingers in your nose or something, and that could happen. It's just not considered a primary source. So if you're living with somebody, you have one bathroom, you want them after they've used the bathroom to wipe down the surfaces that they've touched, right? Have some of those cleaner swabs in there, have them wipe down the surfaces, including the toilet handle, have them wash their hands really well and then wipe the handle of the faucet. What wipe down the handle of your door so as you open the door, and then it's probably the best you can do. Which is why I'll just say the greatest transmission rates are amongst people who are living with people with COVID. There's no question about that. Most people who get COVID is because they're living with people who have it, and so it's kind of hard. You got to be really careful if you're living with in a household with COVID to avoid that infection. I know I infected my partner within, I swear to God, hours. I tried not to, but it's just you're living in the same home, breathing the same air. So yeah, you gotta be really careful. I think the best thing to do probably in a situation is if you could have the people who are in their isolation period for those 10 days, maybe living in a separate part of the home. That would be the best case scenario. But I do know that's not always possible. So
Right.
do the best you can.
Hey, Doc, we need a clarification. Lindsay followed up and she said, I thought Johnson and Johnson was 2 months.
Oh, it is for booster. My bad. I'm so sorry. So Johnson and Johnson is 2 months, and they do recommend if you are within a reason to get the mRNA. But there may be some people who might choose not to get mRNA for other reasons. So and it's okay to get a J&J as a booster. But thank you for that clarification. Eh.
Okay. All right. Well, it's almost 4 o'clock and we don't have any questions coming in. So if you have any closing thoughts, I just want to share one thing. Continue sending your questions to COVID-19 at stclaircounty.org. We're not going to be here next week, so don't look for us next Thursday, but the following Thursday. And then on Monday, hopefully Monday, we're going to be launching our new health department mobile-friendly website. So hopefully you'll be able to find your COVID information and other information much easier than it has been. Doc, take it away. Any closing comments?
I have nothing to say. Thank you for keeping me.
Oh,
Kudos. Oh, I'm frozen. Kudos
there
to
you
all
go.
my fantastic staff. I don't know what I'd do without you guys. Hang in there.
And kudos to you too. Thank you.